Welcome. Today we are going to be discussing something beyond the basics. With renewal for health insurance right around the corner, we are proud to be able to announce that along with the current plan that we have through Humana, there is going to be a second new plan offering from the Meiborg companies. So our overall goal when it comes to your health care is focused on you, the employee. When it comes down to it, none of this whole business works if not for drivers, dispatchers, mechanics, office staff. And in order for you to work well, your body has to be working for you. So when we look at healthcare options, we're focusing on three major components. The first is comprehensive benefits that actually covers you when you need it. The second aspect that we look at are out-of-pocket costs. You can have the most comprehensive benefits available, but if the out-of-pocket cost that you have to pay before you actually get to use those benefits is going to bankrupt you before you get to use them, well, that's not really a true benefit at all. And the third portion that we look at is affordability in terms of monthly premium paid by you and the company. Let's face it, everyone wants to keep the most of their paycheck each month. So you can see right here is this is our current SVC, or the breakdown of what your current coverage is through our plan with Humana. So right now, the way it sits is that there is a $5,000 deductible through Humana. You would pay in network the first $1,000, and the health reimbursement account, or HRA, would pay the next 80% of $4,000, or a maximum of $3,200. So after you have paid your first $1,000, you would pay a co-insurance of 20% through the next $4,000 of that $5,000 deductible. If for some reason you were to have over $5,000 in medical costs in one calendar year, you could have a maximum out-of-pocket responsibility of $1,800 per year. Now, if you just go to a basic doctor visit, your primary care physician, or a regular office visit, you would pay a $25 copay. If you go to a specialist visit, you would pay $55 at the office, and you'd get a check a few weeks later from the health reimbursement account for $30. So in essence, whether you go to a regular doctor or a specialist, you would pay a $25 copay. Your preventative care, which is something that's mandated by the Affordable Care Act, is covered at 100%. This includes your preventative colonoscopies, mammograms, and just other preventative services. Emergency services, if you have to go to the emergency room, your plan would cover 100% of that emergency room charge after a $250 copay. And then you also have your generic brand name and specialty drugs at $10, $40, and $60 copays. Unfortunately, like everyone else in today's market for health insurance, affordability is really the key bullet point that becomes the struggle. Because you can offer a comprehensive plan, you can make it so that the deductibles can be lower, but then the problem is, once again, just with it being affordable. So to provide some history, since this current plan that we just discussed was created back in October of 2011, the premium costs have increased by 161%, and this has been seen by both employees and the company alike. Requoting has also offered no relief on this. Well, we have already incorporated the health reimbursement account into the plan, which keeps an additional $4,000 per individual paid by Meiborg and not seen by Humana as a loss run. We are able to reduce the amount of claims seen by Humana. However, in terms of requoting anything, the deductible being at $5,000 is at its highest available point, and we can't raise it because typically the higher your deductible, the lower your premium cost. Well, we can't go any higher than $4,000 and assume any more from Humana. The plan as it stands is also grandfathered because we put it into effect before some of the requirements of the Affordable Care Act, which makes it a lower cost than other comparable plans on the market. However, this status is going to expire next year, which will certainly lead to an even more drastic increase than what we're seeing right now. So, as such, here are the current renewal rates that will be applicable starting October 1st for all employees that elect a Humana plan. Although these rates for the plan offering are lower than what you would pay on the exchange, I'm sure many people are looking at these numbers and thinking to themselves, yes, but how is this exactly affordable for me? And honestly, we agree with you. While this plan and the rates meet the Affordable Care Act's mandate for affordable for you as an employee based upon income, I'm sure there are many other places you'd rather be spending a few hundred or even over $1,000 every single month than on healthcare costs. So we thought and searched and are proud to say that we've come up with another alternative that offers a lower cost than what you're seeing right now. So if we're quoting a different health plan isn't an option and we can't increase the deductible, how exactly is this possible? Well, we had to think outside the box. And in order to do this, we found that you could actually take two different plans that together gave you very similar, and if not in some ways better benefits than Humana, while reducing the monthly premium cost. Both plans also fulfill the individual mandate of the Affordable Care Act the same way Humana does, which essentially keeps you being fined up to 2.5% of your income or $695 per year, whichever is greater, for not having health insurance coverage. So the first plan is called the DocMEC, or MEC being minimum essential coverage. What this plan does is it combines all of the essential benefits required by the Affordable Care Act, such as preventative colonoscopies, mammograms, and wellness visits, with also copays for basic services such as primary specialist visits, convenient care clinics, urgent care facilities, and lab work or x-rays done at a freestanding facility. So for a $20 copay for a primary doctor or $35 for a specialist, you would have access to your visit as well as x-rays or labs done if your doctor decided that was a required service. The network utilized under this plan is through the First Health Network. They have over 1,000 providers in the Rockford area and are an accepted plan by both Swedish American as well as Rockford Memorial Hospital. This plan would also give you access to telehealth, which means that 24 hours a day, you would be able to connect with the physician via phone, email, and video for consultations, simple diagnoses, and prescriptions without having to physically go into a doctor's office at all. So outside of the convenience factor, this service also is more affordable for you because there's no copay, which makes it not only time-saving but also cost-effective. There's also basic drug coverage on this plan, which covers generic drugs after a $20 copay, and also has a network discount for brand name medications. Once again, in terms of the Affordable Care Act, this plan will fulfill the requirement for you and any dependents enrolled from the individual mandate to purchase health insurance. Obviously, it can be a lot easier to fill a prescription at home where you are familiar with your local pharmacy and pricing. But say, for instance, something occurred over the road and you are required to refill a generic prescription or needed a brand name drug to help with whatever you are battling. Not only could you use your telemedicine benefits to have it diagnosed from the convenience of your cab, but with a few clicks, you could also use an app such as GoodRx to look up your local pricing for the medication that you need. You can also very easily switch between brand name and generic to see what would be best covered under your copay or at a lower cost with instant coupons. So it's just another added benefit. It's available through an app or web-based. The MEC also includes another service at no additional cost, which is the ability to use a service through MediBid. MediBid is a means by which individuals can receive individual quotes for medical services. Doctors locally across the country and even from outside of the United States would review your medical information as well as a medical request that you would submit and send back competitive, all-inclusive pricing for the services that you request, allowing you to shop for medical services based upon pricing, location, as well as physician and facility reviews. This is a great option for individuals that have medical services that they need, but that may be seen either as alternative, might just not be covered by their health plan, or just simply they want a means to shop a procedure that might be all in that deductible portion and keep their out-of-pocket costs as low as possible. With MediBid, you're also allowed unlimited requests at no additional charge as a part of the MEC plan, so it's just another great service you can use in order to control and shop your own medical costs. So while the MEC plan has a lot of great coverage for your basics, as well as a means to shop medical services, that is honestly the sole thing that this MEC is designed to do. That's why it's called a minimum essential coverage plan. This plan doesn't cover benefits beyond what has been previously mentioned, which means that there are a lot of things it does not cover, which you can see listed here. Now, I'm sure there are some people that are wondering why we'd even think to offer a plan that does not include catastrophic, and when you need them, very essential aspects of what most traditional major medical plans have. This is why we're utilizing not one, but two plans that together come closer to being the whole package as offered by Humana. So one of the reasons why health prices have increased so dramatically after the passing of the Affordable Care Act was that insurance companies not only have to expand benefits into covering more services without going through your yearly deductible, but also accept everyone regardless of their health status and limited to how much they could charge individuals for having certain conditions that tended to be more costly. However, there were some groups that had operated very similar to traditional health insurance in the market already that were able to transcend this mandate, leading to more affordable coverage for their members. The catch was they could not classify themselves as insurance, or they would have to subscribe to all of the rules of the Affordable Care Act. Liberty HealthShare is one of those entities. It's been around since the late 1980s, and while other organizations that are similar to Liberty have established as Christian-only organizations, Liberty accepts individuals of all faiths and personal identities that subscribe to certain beliefs pertaining to their own health. Members believe overall that individuals and not the government should be in charge of healthcare. So how exactly does a health membership work? Well, because Liberty Direct is not insurance, some of the terminology you may hear would sound a little different than what you're used to, although the end result is really the same in terms of coverage. To start, to be a member, you would be assessed a monthly share amount, which traditionally on a health plan would be called a premium. This will be based upon the level of membership you have, whether it's a single, couple, or family plan. Every month, you would pay this amount into what they call your share box. When you had a medical expense, now this could be an office visit to your doctor, a surgery, a hospital admission, any variety of medical expenses, your first step would be to visit your doctor. Now with Liberty, this could be any doctor, because Liberty has no limiting network. Your doctor would then bill Liberty directly for any service you would receive, so that you would have a membership card, have a payer ID just like Humana, and they would put this into their electronic software and it would send an electronic claim to Liberty. Liberty would then process your bill, and then other members' share boxes where their shares or premiums were deposited into would be used to pay your medical expenses. Now this is all viewable online on your account, and just like other individuals' contributions would be used to pay your medical bills, your shared amounts or premiums would be used to pay other people's medical bills as they incur them. So essentially everyone's putting their funds into a big pool, and as expenses occur, that pool is tapped. It's similar to what happens just in your traditional medical insurance company. When this happens, when your bills are paid, you would then receive an electronic confirmation letting you know that your bills have been paid, and after your provider has been paid for your services, you would get an electronic confirmation. Now, you can see right here the cost of membership to Liberty depends on the level of members you elect to cover. For a single, this can be as low as $149 per month if an individual or their spouse is under the age of 30, and that would be on a couple plan. So if you're on an individual plan, it would just be based upon your age, or only $199 for those individuals over the age of 30. So as you can see from the numbers above, this is a plan that is quite affordable even for families. And the family rate, that's an unlimited number of children. So the next question on a lot of people's minds after seeing this, well, that's great that it's affordable, but am I actually going to get any benefits from this plan since the costs are so low? So right here is the breakdown of what's called an annual unshared amount. Now the annual unshared amount is comparable to what most major medical plans call a deductible. So what you would be expected to pay out of pocket before anything was shared amongst other members. As you can see, for an individual, this amount is $500, $1,000 for a couple, and $1,500 for a family. Once this amount is met, Liberty Direct would then pay for 100% of plan covered charges up to $1 million per incident. So how is it possible that Liberty is able to provide this low of an out-of-pocket to an individual, couple, or family while also having a low membership cost? Well, unlike traditional major medical companies, Liberty is a lean, non-profit organization. Remember how I said before, you're pooling all your resources together. As medical costs are being incurred, those are being paid out. Well, they're using only $24 per household spent on administrative expenses. So the rest of that pool, as opposed to being profit, paid out to shareholders, stakeholders, presidents, CEOs, all of those, most of those expenses are going and being paid out directly for medical claims. Liberty doesn't pay out high commissions to agents, brokers, or spend a lot of money on sales and marketing. And this $24 that they do spend, that's not an additional cost, but it's already included in those numbers that you saw for your monthly premium or share amount. However, since Liberty is also exempt from the ACA legislation, it also means that, unfortunately, they are not always able to accept everyone to their current program. For some that are not approved, this is because their current medical conditions would be too overwhelming for a cost-sharing program. While unfortunate, this is normally a small number of applicants, around 3 to 4%, that are just not able to be accepted into the program. Another 5% are approved with diagnosis, which would be considered pre-existing conditions, which we will expand upon just a little bit more. So Liberty defines a pre-existing condition as something that has been diagnosed or treated within the past 24 months prior to an individual joining Liberty. Now, having a pre-existing condition does not mean that expenses for medical service related to that condition would never have any coverage. However, it does change the schedule by which claims for that specific condition will be paid. For example, if an individual had a melanoma or a skin cancer and had treatment within 2 years of becoming a Liberty member, it would mean that condition will be considered a pre-existing condition. For the first year of membership, Liberty would not share in any medical expenses relating to that melanoma. However, for all other conditions that member had, Liberty would still cover 100% of charges up to $1 million per incident after your annual individual responsibility was met. In year 2 of membership, however, Liberty would cover up to $25,000 eligible medical expenses for that melanoma. In year 3, that amount goes up to $50,000 that would be shareable, and after the 3rd year, the condition would no longer be considered pre-existing. It would be like you never had it at all, and that would be a fully shared condition up to $1 million in coverage. So if that melanoma would occur in year 4, you would have 100% coverage as if that never existed at all. Finally, going back to the fact that Liberty cannot accept everyone, Liberty does accept individuals with pre-existing conditions. They just slowly bring that individual condition into the cost-sharing community, just a little bit slower in order to make it so that it's more sustainable to be paid by other members. The last group of individuals that you can see here, 7%, are approved with a health tracks to membership, meaning that they're approved by Liberty as a member, but they're on a conditional approval and put on a path to become a full member, which we'll go into more. So this program, referred to as health tracks, looks at a minimum of 6 conditions, which can be seen here on the left. And these are the main 6, which are diabetes, heart disease, hyperlipidemia, hypertension, obesity, and smoking. Now, these specific conditions are known to respond very well to lifestyle changes, such as exercise, diet, better sleep, etc. So these conditions warrant some type of management, and although they are not considered to be a pre-existing and would be eligible medical expenses that could be shared, individuals that have these conditions would be accepted as members under the condition that these could be addressed through lifestyle, and that's where the health track program would come in. This overall is meant to be a short-term program that provides the education or assistance to work towards improving your blood pressure, cholesterol, or other condition. For this short-term program, the health track member will be responsible for an additional $80 per month, which this isn't a penalty, but instead would provide the member with a personal health coach who will check in with you, set goals, and help get you back on track to get these certain conditions under control, to keep you from having high blood pressure, having that heart attack, diabetes, having that diabetes episode, getting those things just more manageable so that you're less risk personally in your own health and to other members in the plan for health expenses. Once these goals are met, that additional fee drops off and you would become a full sharing member. So here you can find some examples of medical expenses that Liberty would cover, or in their terminology, share amongst members for payment. The first 2 examples pertaining to vaccines and well baby, as well as preventative care, are services that would be shared without going into the annual amount that you would have a personal responsibility for. So this would be your preventative wellness that would not go against an annual unshared or deductible. The well baby visits that goes up to 12 months after that would go towards your annual unshared amount. If you do not use a wellness visit during that year, Liberty did say that a DOT physical would count as a preventative service and would be covered at 100% outside of any individual responsibility or traditional deductible. So as you can see, Liberty provides some of that meat and potato service that the MEC just didn't cover. One difference that how Liberty operates is, outside of Humana, is with prescriptions. Now, Liberty shares all new prescriptions that are filled 45 days before or after a doctor's visit, unless it is a chronic maintenance medication. So say you just, for some reason, you were unfortunately diagnosed with cancer, and you had some very expensive medication to start taking. Well, your prescriptions would be covered and shared under Liberty as long as you did have an office visit with your doctor every 45 days to renew that prescription. Now, unless the only medication that Liberty does not cover would be a chronic maintenance medication. An example of a maintenance medication would be that high blood pressure medication that you've been on for years and years. that would not be something that would be a shareable expense, and it would be something you would be responsible for out of pocket. Most of these can be purchased in generic form for a very affordable price, but just to help with this, Liberty has priced out dozens of medications at an already discounted rate. So just to give you an example of several of these that Liberty has pre-negotiated, there are several drugs and for conditions from high blood pressure, gout, diabetes, and cholesterol that are all available for less than $10 through Liberty's SaveNet drug discount program. This program also includes other brand name and specialty drugs that can be purchased for less than $10, $20, some $50, which are all provided to you in a pamphlet that you get in your Liberty new member packet. So this is something that you can sit down, and if you are on high blood pressure medication and you're currently on metoprolol succinate and you decide that you want to go down to lisinopril because of the cost, this is something that your doctor can say, hey, look, this would be a better savings for you, and together you can work something that will give you the medications that you need but also at the best available price for you. Now, there are some conditions that Liberty does exclude from coverage, many of which are also standard exclusions in major medical health plans as well. And these are listed here. Abortion, cosmetic services, dental or vision, which is not major medical, durable medical equipment, exercise programs, negligent acts. If you rob a bank, you're not going to have coverage if you get shot. Personal comfort items, anything that would be self-inflicted, alcohol, drug dependency, hazardous hobbies like cliff diving would not be covered. However, they do not consider things like hunting or horseback riding in this hazardous hobby category. So don't think that if you go out hunting or horseback riding, all these would not be considered hazardous hobbies. Now, some services that are not covered to note would be long-term prescriptions, which we just discussed in the previous slide, non-emergency ER visits, and mental health. For mental health, this would mean that both office visits and prescriptions related to mental health would not be covered services. Now, just to touch back to the MEC that we discussed earlier, office visits for mental health would be covered under either your office visit or your specialist copay. So between these two plans, there would still be mental health coverage, just not for inpatient hospitalization. Non-emergency ER visits would also not be covered if there was another option available, such as an urgent care clinic during the day. To be clear, emergency room visits for things such as chest pains or other alarming conditions would be covered. But going to the emergency room during the day for a sore throat would not be considered a covered expense. And this is simply due to the fact that there were other more reasonable options available, such as an urgent care clinic or a primary doctor, just to name a few. Now, another great benefit offered by Liberty Direct is the addition of being able to use a premier practice for your primary care. And this is honestly really exciting. A premier practice is a physician that offers direct primary care to patients. These are doctors that want to go back to focusing on the doctor-patient relationship and believe that patient care should be based upon the patient, not the rules or guidelines put forth by the insurance company, which that is come nowadays to 7-minute visits. Many of these doctors don't accept insurance at all, and as a result, they don't charge overwhelming rates for their services, and instead charge a flat monthly fee for unlimited care and access. Now, we have a provider that participates in Liberty's direct primary care program in our area, which is Dr. Joseph Eckberg. Now, I went and personally met with Dr. Eckberg at his practice, which is located off Perryville Road behind Crimson Ridge. Now, Dr. Eckberg has been practicing in the Rockford area for over 18 years. He used to be affiliated with OSF, and because of his desire to have that relationship again with patients, he left OSF and instead opened his own practice a few years ago. Now, as a direct primary care provider, he's able to charge a flat monthly fee for unlimited visits to his practice every month, and most of these appointments can be scheduled same day, which is a great benefit for individuals with varying schedules, such as drivers. Dr. Eckberg also provides all-in-office tests, such as blood work and other testing, as well as some prescription medications, and he does that, or would do that for you as his patient, at his own cost. For example, this means that a full blood workup can be done for less than $20, or an entire month's worth of metformin for about $1 per month. For x-rays, MRIs, and more in-depth testing, Forest City Diagnostics is only a few steps away from his office, and he's walked patients there before. As his patient, he would also help you to get the best pricing available for services. Dr. Eckberg also provides his patients with his personal email and cell phone, so even if you're not in Rockford or just simply don't have time to come into the office, but you have a question, a concern, you would still have access by phone, text, or email to your personal doctor for any questions or concerns, whether at home and sick or over the road. This would essentially be telemedicine with the incorporation of your own personal physician, which is pretty amazing. I mean, he even told me he's diagnosed things and written prescriptions via picture sent from a text message before. Liberty will actually contribute a certain amount, depending on your level of coverage, to the monthly fee that is charged by your direct primary care doctor. Above, here you can see the breakdown of how this would work at Dr. Eckberg's office. His monthly rate for unlimited visits and primary care is $50 for each adult and $10 per child. As you can see, Liberty will actually pay up to $60 per month for an individual, meaning that if you decided to use this program, you would essentially eliminate your regular office visit copay, since Liberty would cover all of your monthly fee. And that's not just for one visit. That is, you could go and see him every single day during the month, and that would still be covered under that fee, and Liberty would pick it up for you. Not that you're going to, but you could. For a couple or a family with 2 adults and 2 children, you could receive unlimited primary care for the cost of one $20 copay per month. Same with as just a couple, which is, once again, is amazing for the level of personal relationship and access to same-day appointments, as well as pass-through savings on medication and lab work, not to mention the personalized telemedicine of being able to call your doctor at any time, having them know you, and having them understand who you are, what you're going through, and what you need. So now that we've reviewed both of these plans, the MEC, which is the minimum essential coverage, as well as Liberty Direct, I just want to go back real quick and see how the benefit offerings compare to the current plans offered by Humana. So as you can see, where it breaks down what you would pay, just take out the HRA. So per year, you would be paying $500 individual annual unshared amount or deductible for Liberty. Now, if you're a couple, this would be $1,000. If you were a family, this would be $1,500. Now, the one thing to mention about this coverage right here is this health reimbursement account only applies to employees. It does not apply to dependents. So when you're looking at an in-network deductible, you're looking at $1,000 plus 20% of the next $4,000 for the employee only. If this is an individual with a spouse, you'd actually be looking at the spouse would have $5,000 of responsibility before the Humana coverage would kick in. So if you were to max out between the two of you, you'd actually be paying $6,800. For a family, that would go up to $11,800. So you can see that those deductible differences outside of the individual level, more on the couple and family level, are quite drastic between what you would have between Liberty and Humana. So here, your co-insurance, you wouldn't pay anything after that individual unshared amount. You wouldn't have any co-insurance here. And your out-of-pocket, well, that's maxed out at your individual unshareable amount too. So that would be $500, $1,000, or your $1,500. So right here, if you go to your emergency service, once again, there's no copay there. That goes under one single charge. And if you look at your office visits, that could be zero if you use the direct primary care provider program through Liberty. Now, the minimum essential coverage plan would be right here. That would provide your copays for your office visit, your specialist, and your urgent care facilities, as well as some copays for your labs and your labs and some x-rays in office. Now, the two plans together, those would cover your preventative care, so you would actually have one wellness visit per year from your minimum essential coverage plan and one through Liberty. So you could do your wellness visit and then have the other one cover your DOT physical. And then you would have your discounts for your brand name prescriptions, $20 copay for generics, and also if you use this direct provider program, Dr. Eckberg could get you plenty of discounts on medications that he could prescribe through his office as well. So how do the two plans stack up in terms of affordability? So let's see. So we believe that for all the benefits offered, as well as the lower annual out-of-pocket amounts, the combination of the MEC as well as Liberty Direct are just excellent at providing individuals with a more affordable health care option during this year's renewal. This is especially true for individuals that provide insurance coverage for dependents, such as spouses and families. So as you can see, that's where the numbers are really significantly different between Humana and this other plan offering. Now, also to note is that if you are under 30, your amount here would be $50 less. So you could take that $124.57, just subtract 50 out of it. That's the same if your spouse is under the age of 30 or you are under the age of 30. That would cover here, and that would go all the way down. So these rates would go down by $50 per plan if you or your spouse is under the age of 30. So even those individuals that were required the enrollment in the Health Track programs, there's still a significant savings in monthly costs. The only thing to additionally note with Health Track plans is that the premium listed here is assuming that only one individual is on the Health Track program for the additional $80 per month. If more than one individual requires Health Tracks, obviously that number would need to be adjusted to include any additional individuals at $80 per month. However, the employee-only cost would obviously not change since you're only looking at one individual anyway. So the next question you would ask is, which plan is right for me? And right here, I mean, if you have certain pre-existing conditions, well, Humana really should be a place that you might want to stay, because if you have something like cancer or other severe conditions that you need continuous care treatment, well, Liberty might not be as covering of that as you need. If you're unwilling or not wanting to make lifestyle changes, if you're a current smoker and smoking just isn't something that you're willing or just really not wanting to change at this time, well, then the Health Track plan will not be successful with you if your overall goal is to not quit smoking. Humana would also be a better choice if you just want a traditional health insurance plan, or if you're just satisfied with your current coverage. Now, I mean, to go with the MEC and Liberty Direct, if you either have no pre-existing conditions, you don't really go to the doctor, or the pre-existing conditions that you have are very manageable, meaning that you could use the direct care program, you could manage them with medication so that after that first year, if something were to happen, you would have coverage. If you're open to making lifestyle changes, you really want to lose those extra few pounds, you really want to get your cholesterol under control, you really want to get your blood pressure down, you really do want to quit smoking, and for some things you just need a little bit of extra help, well, then this would be a great way to do it and also save money on your monthly premiums. So, I mean, also, if you want another option to the high cost of traditional insurance, then this would be a great alternative for you. Or if you are especially a primary supporter and you want to cover a spouse or children, this allows you to do it for a lot more affordable than you could through Humana. So another great aspect is that you're currently unsure or have a medical condition that hasn't had treatment for a year and 6 months or for any other reason, you can join Liberty itself at any time. There's no open enrollment period. So, but if you do decide to go with the MEC and the Liberty plan, you need to be sure that you're committed to, especially if you're on Health Tracks, to making lifestyle changes. In order to keep the current rate from going up for as long with Humana, our next open enrollment will not occur until January of 2018. So once again, if you're on the Health Track program but you really don't want to quit smoking, then you should stay on the Humana plan, or you might risk not being able to re-enroll again until January 1st of 2018. Another thing to note outside of medical is that we are going to be slightly changing our vision and dental offering. The prices will be less, and they include dental and vision together as a bundled package. Your dental benefits are the same as what you're currently getting through Delta Dental. The only difference is there is no network. The vision that is offered through Humana, there's also no network here. It also, while your eye exam and copay goes up slightly, the ease of being able to figure out how much coverage you have for your frames, lenses, or contacts, it's very simple. You have 100% coverage up to $300 per year. So it simplifies that. And you're going to have some savings here between the dental and vision premium. So they're combined, but the premium for the combination is less than it would have been through the other plan that was available. So if you have additional questions or still just aren't sure if the MEC or Liberty are the right plans for you or your family, there are a few additional resources you can go to with more specific questions or concerns. The first is Meiborg directly at the email listed here, which is healthinsurance@meiborginc.com. If you have specific questions about how the MEC or the Medibid plan would work, this is the direct phone number and email for Maggie Beckley, who is our representative. Liberty also has a great feature through live chat that's accessible from their website here, which is staffed between 8:30 in the morning and 10:30 at night Eastern Standard Time. And I've also listed a phone number in case you wanted to speak directly to a representative about some questions. But overall, we hope that this plan combination provides some individuals, maybe not everyone, but at least some, with another option for you and your family's healthcare needs that is comprehensive in the benefits offered, has lower out-of-pocket costs, and is also affordable. And honestly, in this market, it's another choice. As opposed to this is what we have, take it or leave it. This gives you another option that can save you money. So thank you very much for your time, and happy renewal.